Okay, so welcome everyone to Phoenix Occupational Health Orientation to the NCLEX USA examination orientation. So at Phoenix, we believe in transformation through education, and we're going to start by telling you a little bit of ourselves. So Phoenix Occupational Health is owned by myself, Miranda Ramjatan. It was established in 2020, just before COVID hit. We do BLS and ACLS training. That's with the American Heart Association, as well as do first aid, CPR, and AED training for non-healthcare workers. We also train in ECG and arrhythmias interpretation and NCLEX preparation, and we have a few occupational health courses that will soon be available. Yeah, also conflict management as well as customer service training done by us. So for those of you who don't know me, I am a registered nurse just like you, emergency and ICU trained and experienced. I'm also a preceptor for Southwest. I was one of the first students to be trained as a preceptor in Trinidad under the new preceptor program. I'm also a trainer for the customer service workshop for Southwest Regional Health Authority, as well as in-house nursing courses. I am an AHA instructor and I currently work as a district health visitor within the Southwest RHA. I also have a master's in public health and a trained and experienced occupational health nurse. So for those of you who don't know what I look like, this is what I look like. So I'm not just some bot online trying to take your money. If you see me, feel free to say hi and hello. Right? One picture is with short hair, one is with long hair. So we're going right into NCLEX cost. So we are going to go through a board that does not require IELTS, which is the Chicago board or maybe the board or Colorado board. However, we are not too sure when you reach that stage, if when you reach the visa screening, they may ask for it from CGFNS. So I left it in there just in case, all right? The cost to send the result of your IELTS, those of you not familiar with that particular exam, it's an English-based exam, which is required for most countries. We're going into the US, stating that you have English proficiency, you can speak English very well. That is an exam that is done locally at SBCS or UE, depending on the date that you choose. But we're going to leave that course out until we reach the visa screen. CVS evaluation is the first course that you're going to occur. It's not 225. Mine was 225. It's actually 450. All right. It's 450 US to start the process with CGFNS, and that's to get your license verification as well as your transcript sent off in order to get that CS evaluation. Your CS evaluation stands for Credential Evaluation Service, where it looks at your nursing diploma as well as your licensure and says whether you qualify or not. So I know a lot of the students who have joined us today are from the ministry batch, and they were worried about that. There's no need to be worried. Your program is an accredited program within Trinidad and Tobago, and your license is verified. You did pass the Nursing Council exam. So don't be too worried about not making your hours in theory. The agencies, however, they are investing money into you. The reason they won't take you is because they find that you don't have enough theoretical hours as compared to an associate degree and a bachelor's, but you do have a license in Trinidad and Tobago to work as an RN, and you did go to an accredited school within Trinidad and Tobago, so there's no need to worry. When you get your credential to send off that, you have to pay for your transcript. For those of you with the Ministry of Health or Ministry of Education School, which is the certificate or the diploma program, both your documents have to be sent off from Nursing Council. So that will be incurring a price of approximately $550 to apply for it and send it off to CGFNS. Any questions so far?
No.
All right.
I think I get enough feedback, and it's a little like
somebody's mic is on. Can everyone check their mic? Somebody's mic is on. Thank you. All right. So if you did your training with CoStart, it would be $230 TT to send it off. All right. I'm not familiar with USC or Southern Caribbean. If any of you are from those schools and you do it, let me know so we can let students know in the future. The cost of selling the ITS to the nursing board will be $400, but again, TT, that will not be sent by you unless it's time for the visa screen and they ask for it. Sometimes they don't, sometimes they do. I don't know what is the criteria. Maybe the person who is making the judgment on the application decides that. The cost, then you have to get your fingerprint screens done for your nursing board that you apply to. It is $44 US in order to do that. We don't pay that until I let you know because of Nursing Council taking forever to send off your stuff. We don't want it to expire. There's a time of that it is valid for and then it expires. So along this process, I will be guiding you. I normally tell my students because Nursing Council is taking so long, if you could save that $450 US, put it on your credit card or whatever, do it early and get your transcript sent off because they're taking more than 4 months now to send it off. Then we're going to have to mail your fingerprints after we get your fingerprints done. We don't normally wait for them to send us the cards. I have cards for those of you who wish to purchase because they take forever. And then when they send it in email, it comes all crumpled. You have to get your fingerprints done at the police station and then mail it back off to the nursing board. There's no cost to getting it done in Trinidad. It's not like the certificate of character where you have to pay for it. You just go in and ask them to do it and they will do it. However, you do have to book an appointment. Even though the appointment system is not valid anymore, they still want you to book an appointment. You'll turn up by the police station and they'll ask you for it. So to save yourself some harassment, we just make it online, okay? So then we are looking at your NCLEX examination that you have to pay for, and this would be an additional $200 US. Right, so basically we're looking at 3,700 TT that you're going to be investing in yourself with a total of 469 US. So when you convert that into TT, it's about $6,983, just over under $7,000. If we're looking at your flights, if you're going in, depending on when you're going and how long before you book your flights, it could be anywhere from 4.5 to 5.5. But that was last year's prices. It may change this year, but again, the earlier you book your flight, the better for you. So basically, you're looking at somebody's mic is on again. All right, so basically you're looking at between 10,000 to 10,500 that you're investing in yourself over a 6-month period. Any questions so far?
No.
Okay, we're moving on. All right, so basically the plan of getting you to NCLEX is a 7-month training plan. We're going to take 4 years of nursing school and condense it into 6 months. Within that time, their learning materials will be given every week to you in a PDF version. You can print it if you wish. You're going to get 4 of the top sources for NCLEX, which is UWorld, Simple Nursing, Marquet, and Saunders. I am going to combine it because you would find sometimes UWorld doesn't cover a particular topic, or it does and the others don't. UWorld is one of the closest things to NCLEX. I personally used it when I wrote exams. I wrote exam last year, August. I passed on my first try with a minimum of 75 questions. So like you, I had this dream and I wanted to know that I passed it the first time. So I listened to all the blogs, I read all the materials, I researched how to pass NCLEX, and there's no quick fix formula. You have to put in the work. Putting in the work does not mean learning the materials alone. It's learning to answer the questions. You can know the learning materials very good, but when you see those questions, they are so tricky. You have 2 very close answers. One is right, one is wrong, and then you have 2 very wrong answers. Now you all are going in where you have SATA questions. You are fortunate in that if there are 3 possible answers and you get 2, you still get the marks for 2. Before, when I wrote it, if you didn't get the 3, you got the entire question wrong. So my weakness in this particular exam, we all know ourselves and we know what our weaknesses when coming exams. And I will tell you, my weakness in any exam is multiple choice. And guess what NCLEX is? multiple choice, right? So I had to really make sure I knew my information, and the best way to know that you know is to do the questions and practice getting the questions. The other weakness that I had that I really worked on was the SATA questions in order to get them correct. It was my weakness. I would always miss an answer. Therefore, I would get it wrong. However, you all would still get marks for the ones that you would get right. If you're not sure of an answer, don't choose it, because if you choose an incorrect answer, they're going to minus a point, right? We're going to discuss how the scoring system just now. So now, after you get your learning materials, 1 week is learning material, and then the next week you're going to get questions. It is not a test. Do not consider it a test. Do not worry about how you score the first time you do it. You're not going to pass every single one. You're going to score 50%, 40%, 30%, even 20%. That is okay. You are learning to answer the questions. One of the classes that we are going to have before you get your first set of questions is strategies on answering the questions, a different type of questions and how to choose the answer. So I'm going to be teaching you how to answer these questions, right? Now, some of my students in the other class, they wanted to study materials and then do the questions. It's not going to work like that. Once they study material, the classes range between 2 to 4 hours. So you have to commit to answering the questions. Don't save it up. When you save it up for that last month before your exams, you're going to get panic attacks. You're going to have anxiety of how much you don't know. We don't want that happening. This program is designed to get you in a gear over a 6-month period, but you have to do the work when I send it to you. There's no two ways about it, right? I always encourage the students to ask questions in class. If there's something presented and they don't understand, you are free to ask a question. In my classroom, there are no stupid questions, and I like to create a safe environment. It's better you ask me something than you go confused, all right? Most of the materials, again, would be a lecture discussion. The materials, again, would have cheat sheets on it. It would have NCLEX tips and top missed NCLEX questions, as well as I will condense it for you. So I will take an entire paragraph and make a flow diagram for you, or put it in a table form, so that is easy for you to learn and you don't have to keep reading paragraph after paragraph. I know Saunders could be very wordy, and it's a very good source to learn from, but even me, myself, after one paragraph, I like, what did I just read? And I have to start all over. And then I used to read to fall asleep. So from the time I read one paragraph, I am in la la land, snoring. So with you, what I would advise you to do, you all are full-time parents, you are full-time workers, you have to find that time in order to study. Do not let work and life bug you down. It's going to bug you down. But if this is your dream and you want this dream to happen and you want to happen on the first try and be out of here by next year, you got to put in the work. You have to eat, breathe, live, NCLEX for the next 7 months. Right? What I advise my students to do, you usually get about 75 questions, sometimes every week, sometimes more, sometimes a little less. Do 5 a day. Now, the questionnaire itself is a learning material. When you do the questionnaire, whether you get it right or wrong, you see the rationale. So even if you make a guess and it is wrong, you see why it is wrong and what is the right answer. If you guessed it right, you're going to see why it is right. So it is a learning material, and it's all about building knowledge now. So a lot of students, they want to go back and listen to the lecture and stuff. Don't do that. Just go and do the question and do it as soon as possible after the class is done. So the work is fresh in your head. The method we use is repetition, right? So these questions that you're getting now, they will not come back. They may come back in different forms. You're going to be doing up to 5,000 questions by the time you are ready to write NCLEX, and you have to do it. For me personally, what I did, I had bought a UWorld subscription, and I think they had about 25 or 2,900 questions. I did those questions twice. The areas where I had a shortfall, I would look at videos and I would find other materials in order to help me. So I am an emergency ICU nurse. I'm not a midwife, but I'm a district health visitor, one of the new ones who got a scholarship for the chronic disease. So for me, there are 3 weak areas: psychiatric nursing, maternity and delivery, the newborn, as well as pediatric. I have very little pediatric experience. I work with mostly adults. So I knew what my weaknesses were. My weakness was multiple choice, SATA, psychiatric, maternity, and pediatric. So I knew I had to pay really good attention to it and focus on your weak areas. All right. So the systems that we are doing, this is basically a synopsis of how we're going to approach this. We're going to look at lab values at the start of the class. Now, you don't have to know all your lab values, right? It's no longer necessary for you to know it because with NextGen, they're going to give you the lab values. However, you need to know if these are within normal range or abnormal range. They will give it to you, but I will tell you, if you know that lab value, particularly for the electrolytes and stuff, the major ones that always comes with these seriously ill patients, it allays your anxiety because from the time you start seeing lab values and you're not familiar with it, you start to panic and worry, how am I going to answer this question? Right? But we're going to give it to you. It's a cheat sheet. You don't have to learn all of it, but at least know like sodium, potassium, the electrolytes, the bond, the creatinine. Those always comes up. We're going to do medications, but in different systems. When we do it, you're going to get the medications associated with those systems and the ones that are tested. Then we're going to do body systems. We're going to do the body systems under the pediatrics first, and then later on, we're going to do the adult. Psychiatric nursing, antenatal, postnatal care, ethics and professional development, child health and development, fundamental skills and procedure, and then finally we'll do ECG and critical care nursing. It is not going to follow this format, however. My way of doing it is that I would give you a hard class and then an easy class. So we would start off with your lab values. I like to do that to let you know and have the sheets. You could print it out and you could start memorizing. There are also other things on it like values you need to know for digoxin and gentamicin, the therapeutic values and stuff like that, okay? So we do that class first and then we go into psychiatric nursing. Because like me, most of you would not have much experience with it. You would have only done your 6 weeks affiliation or 8 weeks affiliation during studentship. So we do psychiatric nursing to get it out of the way. You have it there. So whenever you need to go and study the conditions and the medications. After psychiatric nursing, we will do the neurological system in the adults. The reason we would do that, and we'll touch on some of the pediatric conditions as well. The reason we go from psych to neuro is the drugs are related to each other. The same drugs, they're acting on the brain and the central nervous system. So it sort of seals the information in your head and you have it there. All right. After neurological, well, after each one of those, you get your questions. Okay. So psychiatric is 1 week, then questions. Neurologic 1 week, and then questions. From there, we'd go into an easy topic, which would be the ethics and professional development. So we do a hard topic and then we do an easy topic. I don't want to overwhelm you. All right, now ethics and professional development is very similar to ours. There are just certain areas we would have to do when it comes to HIPAA and the cultural differences. You would have to know each culture and religion, what are the special needs for them. After that, we would start the antenatal and postnatal care, followed by child development, child health and development. When we finish that, we would go into adult health. We do all the adult conditions according to the systems, and then in between we'll do fundamental skills and procedures as they come along. So we're going to do all the medical surgical conditions for these particular systems. Finally, in the 6 months, which would be around February for you all, we're going to do ECGs, arrhythmias, and critical care nursing. Because you've already done all of the systems, we are now going into the nitty-gritty of critical care. Now, you all are wondering about costs. So again, the cost for registration, if I do, now you can go online and do your registration for CGFNS and the board and everything yourself. It's a little bit complicated and it can be very frustrating. The purpose of me doing this is to take the frustration out of you so that you just do your studies, all right? So to do all your registration for you and to guide you along the process, it is 400 TT. That's my fee. Classes are $100 a week in which you get the PDF version of it and you get the recording. The recordings may not be posted in the chat. It will be on a YouTube link where you could go in and have a look at it anytime that you want. You just look for group 3 and whatever lesson 1, lesson 2, the name will be there. You have access to it for the time that you are enrolled in the program. All right. You can send email payments via online or direct deposit into the account. Once you have agreed to sign up with us, I will put it on the chat and you all can start making your deposits. I usually ask for payment up front at the beginning of the month. If you know that for some reason you have some difficulties, talk to me so I don't have to call you. All right. Any questions so far?
No.
All right, so we're moving on. So some of the benefits of doing NCLEX on your own. So I know some of you would have been refused by the agencies. Don't worry, darlings. They were going to be begging you to sign up with them soon and offer you their $10,000 and their $5,000 and $3,000 bonus. The major thing of doing it on your own is that you move at your own pace. Well, you move at my pace, not your own pace. And you get the bonus when you have NCLEX. You get to choose the agency that you want to go to. So, you know, some agencies, they have different rates of pay. You choose which agency you want, and you can even negotiate your rate of pay with them. For me personally, I want to do travel nursing, so I sign up with a travel nurse agency. They're a little bad on customer service, but other than that, they're good. And they're one of the highest paying in the industry from my research. So I guess it trades off for the customer service. All right. The only disadvantage I could come up with doing NCLEX on your own is the cost is your own. You have to put out the money up front, but you are going to get it back in your bonus when you sign up, and you're going to get it in US dollars so that you can set up yourself nicely when you go across there. Buy a car, because you have to buy a car in order to drive yourself to work. Now, let me tell you something about the NCLEX exam. A lot of people on the blogs and the vlogs and stuff, I see they ask like what questions have been featuring in New Gen NCLEX. The NCLEX exam is not set like that. They have certain number of questions, a percentage of their questions that they have on certain topics. However, if they ask you a psychiatric question and you get it wrong, they're going to bring you another psychiatric question. So they start off with pretty easy questions, right? But if you get those easy questions wrong on that particular topic, they're going to bring back an even easier question on the topic. They are literally begging you to pass the exam. All right? It's not a hard exam. A lot of anxiety and angst because only the people who fail post it up. It's very rare people who pass post it up. They just over and done with it. If once you are prepared, NCLEX is not hard, just like any other exam if you're prepared for it. But computer adaptive testing means it's not going to test us all the same way. So, you know, when you wrote CXC, you had the same multiple choice paper that the brightest person in the class had and the dumbest person in the class had. You are not going to get the same questions like everybody. The computer adaptive testing adapts to you. So if they give you an easy question and you get it wrong, they're going to give it to an easy question. You get that wrong, they're going to give it to an easier one and keep giving. They want you to pass that particular topic. You have to pass that percentage before you move on. Of course, they won't keep bringing it the same time all the time. They will move away, bring another question, and then bring back a psychiatric question for you, right? Now, if you get the question correct, they are going to bring a slightly harder question on the topic. So the more you get right, the harder your exam gets. So your goal is to achieve and maintain a certain level of difficulty so that the computer algorithm can evaluate your knowledge level. So you don't want to be the best of the best students because your exam is just going to get harder and harder. You want to find a middle ground, okay? Now we're going to talk about the type of question. So of course they have the traditional multiple choice question where you are given 4 choices and you choose one, 2 of which is very wrong, 1 close to the right answer, and 1 is right. In the select all that apply, as I said before, you all will get those, get points for those that you got right. The hotspot questions, you might get like a chest, the picture of a chest, and you have to say where you would auscultate a particular murmur or a heart rhythm, like the apex of the heart, or even lung sounds, okay? Then you have fill in the blanks. The fill in the blanks, you have a free text answer, which must be correct, and this will often be a number, such as a dose calculation. Now, if they ask you to calculate medication to 1 decimal point, you do it to 1 decimal point. Don't just do the calculation and then put 3 or 4 decimal points. You are going to get it wrong. They ask you to do 1 decimal point. Then you have the drag and drop, which is where the test taker order the answers in the correct order. So they're going to give you a box on the left-hand side with certain steps, and it might be like how to put on a sterile pair of gloves. And on the right-hand side, you have to put it in the right order. You have to take the ones from on the left and put it in the right order on the right. Then you may get charts or a graphic question, which consists of an image as well as a text. Example, a heart rhythm. You would be given a heart rhythm like bradycardia, tachycardia, and another arrhythmia like ventricular tachycardia, torsades, state points. Don't worry, you will be taught all of those before. Now for my exam, of course, I'm an ECG teacher and BLS and ACLS instructor. Excuse me. And my question that came, my one for my exam, it was actually bradycardia. And it was a pulse rate of 58. So it looked almost normal. So be careful when you're looking at the arrhythmias, such as a tachycardia or a bradycardia. You want to do your calculation using the small boxes because it looked almost like a sinus rhythm, but I said, you know what, let me not take any chances and let me just count these boxes and calculate my heart rate, and it was 58. Fortunately, I did that, I got it right. It didn't bring me another one. I only had one in my exam. So you also have graphic answer multiple choice, and this is the same as normal multiple choice question, but they use graphics or images as the answer instead of the text. So it might show you different positions and where a person may have to be placed, or in which to hold a baby, or where to put the electrode. So you would have to choose a picture instead of a text as the answer. Then you have the audio video, and these are questions that you would have to listen or watch a video, and they would probably give you like a heart sound or a lung sound, and you have to identify which is it. It will give you the options in text. Now, NCSBN, which is the Nursing Council Board, they are the ones who create this exam. So of course, they evaluate your exam over a period of time to see how people are doing. So they find that RNs are often more caring for critically ill patients. So they tend to place the NCLEX. So actually, the NCLEX is based on more focus on caring for critically ill patients. So basically, when you're answering the question, you're going to look at the question of what is going to kill the patient first. Basically is that. So like, for instance, priority would be ABCs, right? But there are certain questions, and I always reiterate it when I'm doing these prioritization questions with my students. If you see things like altered mental status or loss of consciousness or change in level of consciousness, remember, when we're talking about the Glasgow Coma Scale, anybody with a GCS of less than 8, they need to be intubated because they are basically unconscious and they may not be able to maintain an airway. So in a question, we have apply oxygen or intubate the patient. If you see the change in level of consciousness, so they would probably give you a scenario with 4 patients, they take over the ward, and they give you 4 conditions of 4 patients. One patient has a chronic wound that is oozing. Another patient may start to wheeze and has a saturation of 94%. Another patient would have altered, is changing in mental status, or their level of consciousness is in and out of consciousness, and they may even have a pregnant patient who is in labor. Which one of those patients would you attend to first? Of course, it's not going to be the asthmatic who has a 94% is abnormal. Yes, they are priority, but for a patient who has altered mental status or changing level of consciousness, that person is your priority. So you are going to choose that person first. So that's how the priority questions may come at times. And I normally point it out to you all the time so that it sticks in your head. Now, new NCLEX, so the next gen NCLEX will have a minimum of 85 questions and a maximum of 150 questions, and you have 5 hours in which to do it. In that 5 hours, I think you could take about 3 to 4 breaks. I think it's a minimum 2, but they would allow extras. You could come outside if you find that your questions are coming in a particular topic, you know that you're getting it wrong. Come outside, take a walk, clear your head, drink some water, say your prayers, and go back in. You have 5 hours. I always tell my people, arrive on time for the exam. They don't allow you into the room before. They usually have a waiting room for you. And as usual, just like in Trinidad, there are going to be people there talking about how many times they fail the exam, how many times they study, how much they study, how much. You don't need to be part of that. You stand outside, say your prayers. When they're ready to call you in, go in. Don't let people mess with your head. So, however, of those 85 to 150 questions, 15 of those questions are pretest questions which are not scored. So your test takers expect between 70 to 135 questions that are actually scored on the next gen questions. From what I'm seeing on the assessments, basically you have to have 50% and over to pass exam. So 50% of 70 is 35. You have to have 35 questions correct to pass, but you want to get more than 50%, right? We're aiming for higher. We're aiming for 70s and 80s and 65% and over to ensure that you pass. But again, I am just giving you information now. This does not mean that when you get your first assessment, you want to score the top of the top of the top. It's all about learning to answer the questions. I am not going to judge you. However, the app is giving some trouble now. So whenever you get your question, you have to send it back to me so that I see your scores. I look at your scores and I look into see which area you are deficient in. If it's a particular topic, so I know if I have to go back and review that topic or review a particular topic, depending on how the student scores. So please do it and send it back to me. We're not going to talk about this. This is just basically the test plan that I would have gone over. So this is your NCLEX RN test plan and the type of questions that you get. So in safe and effective environment, when we're looking at your environment, the management of care, 15 to 21% of your question comes in the management of care. And it's all about keeping the patient safe, right? Then we look at safety and infection control. That is 10 to 16% of your questions. We look at health promotion maintenance, which would be 6 to 12%, as well as the psychosocial integrity. When we go to physiological integrity, we're going to look at basic care and comfort is 6 to 12% of your question. Pharmacological and parental therapies is 13 to 19%. Reduction of your risk potential would be 9 to 15%, and your physiological adaptation 11 to 17%. Now, when you get your questions, you're going to get them in all those categories initially. All right, so you'd be able to tell what topic you're covering. We discussed this already. Now, another disadvantage to the computer adaptive testing is that guessing can artificially inflate your scores of low ability candidates because they can guess these items correctly 25% of the time. And it has nothing to do with their ability. They're just lucky. But however, with the computerized adaptive testing administering these items, it is able to produce exam results that are more stable using fewer items by targeting items to the candidate's ability. However, we're going to strategize when we're guessing. I'm going to teach you how to make accurate guesses to make the answers, not just luck and chance. The goal of the CAT is to determine the ability of the candidate in relation to the passing standard. Every time the candidate answers an item, the computer re-estimates the candidate's ability. And with each additional answered item, the ability estimates becomes more precise. The item is limited to the content area that would produce the best match to the best test plan percentages. So they want you to come, if it's a 6 to 12%, they want you to come as close between getting that 6 to 12% on a particular topic. It is ensured that each candidate's exam has enough questions on each component area to match the required test plan percentages. So regarding clinical judgment items, you have 3 case study sets and approximately 10% of your standalone items, which would be a multiple choice, right, will be selected depending on the exam length. An item or item set is selected that the candidate is expected to find challenging. Based on the candidate's answer up to that point and the difficulty of those items, the computer estimates the candidate's ability and selects an item or item set that the candidate should have a 50% chance of answering correctly. This way, the next item or item set should be not too easy or too hard, and the examination can get the maximum information about the candidate's ability from the item or the item set. It excludes any item or item set that a repeat candidate had seen in previous exams. So you are not going to get the same questions. If you have to resit your exam, the same questions will never come back to you. Now, to decide how you're going to pass or fail, the decision as to whether a candidate passes or fails the NCLEX RN exam is governed by 3 different scenarios. Scenario 1 is the 95% confidence interval rule. In this scenario is the most common for NCLEX candidate. The computer will stop administering items when it's a 95% certain that the candidate's ability is either clearly above or clearly below the passing standard. Scenario 2 is the maximum length of the exam. If some candidates' ability levels would be very close to the passing standard, and when this is the case, the computer continues to administer questions until the maximum number of items is reached. So they're literally begging you to pass the exam. Right? At this point, the computer disregards the 95% interval rule and considers only the final ability estimate, which is at or above the passing standard, the candidate will pass. If it is below the passing standard, they will fail. All right, so they will keep giving you questions up to 150, trying to get you to pass this exam. In scenario 3, if you run out of time rule or the root rule, if the candidate runs out of time, which is a maximum of 5 hours, and before reaching the 150 questions, the computer has not been able to decide whether the candidate passed or failed with 95% certainty. So therefore, they have to use an alternate rule. If the candidate has not answered the minimum number of items, which is 70, they will fail the exam. If the candidate has answered the minimum number of items and the exam is scored using the final ability estimate computed from the responses to all the computed items. If the final ability estimate is or above the passing standard, they pass. If it's below, they fail. Any questions on that so far?
No.
Okay, then. Now, occasionally, you may receive an item that seems to be very similar to an item that you received early in the examination. This could happen for a variety of reasons. For example, several items could be about similar symptoms, diseases, or disorders, but address different phases of the nursing process. You know, your ADPI, assessment, diagnosis, implementation, planning, implementation, and evaluation. So it's the same topic, same symptoms, but different parts of the nursing plan. Alternatively, it's a pretest or unscored item that could appear to have a content similar to the operational item. It is incorrect to assume that the second item, which is similar to the content of previously administered item, is administered because you answered the first item incorrectly. And that is exactly what happened to me. So I got a question in my exam about hospice, what type of care hospice offers. And then I got the very same question, 3 questions down, and I was like, what, did I just get that one wrong? So they bring it back here. So of course I changed my answer, but it could have been a pretest question. Always select the answer you believe to be correct for each item administered, and always go with your gut instinct. Now with the NCLEX exam, once you answer a question and you press submit, you go to the next question. You are not allowed to go back to the questions that you answered before. So make sure when you answer the question, it is the answer that you want to choose. Take your time. You have 5 hours. They're giving you, you can take your breaks. You could go outside, say your prayers, drink some water, jump up and down, stretch, and come back in. Now, rapid guessing, as we discussed before, can drastically lower your score. Some pre-test companies, you know, in CXC, your teachers used to tell you just color it if you run out of time and you have 1 minute and 10 questions, just color it. You have a 25% chance of getting it correct. We don't advise that with NCLEX because, again, it adapts to your correct answers and your wrong answers. All right. Doing this can be very disastrous in your NCLEX exam. It has the effect of giving the candidate easier items, which further lowers your candidate ability estimate that the computer calculates for you. So the best advice is to maintain a reasonable space, spending no more than 1 to 2 minutes on each item, and carefully read and consider each item before answering. So in the new gen or the next gen NCLEX question, you have case scenarios in which you would get between 2 to 8 questions on a single case. So they will give you different pages or tabs with information, and it might start with the admission, the nursing admission, the signs and symptoms, and then the doctor's findings and the doctor's orders, then the nursing care, and then the questions will come on that. We won't go into it today when I do strategies on answering questions. We will go in more detail on this, okay? Then you have the extended selected apply, which is more option to select. You might have up to 8. Again, partial credit will be given for answers that are close to correct, okay? Now, drop-down answers are essentially a cross between the multiple choice and the fill in the blank, and these questions will provide a drop-down box with a list of possible answers to complete a sentence. We're going to go through that before you get your first question in. You also have the extend, drag, and drop, which is same as the traditional, except that there will be more answers and spaces than were before. You have the highlight the text. So these questions will be answered by highlighting an area of text from a given passage. So they would probably give you the signs and symptoms or the patient complaint, and they would ask you which part of the above would be of concern for the nurse. So if you see saturation of 93%, tachycardia, respiratory rate of 40, those are texts within the passage that you would highlight. You have the matrix grid, which will be like a select or let apply question, but just with more options to select or don't select. So you'd have a list of 8 different interventions, and you have to choose if they're anticipated, non-essential, or contraindicated based on the question that you are given. So scoring. Now, standard question from the old NCLEX, including the fill in the blank, multiple choice, select all, apply, and hotspot, will continue to be worth 1 point. However, in the SATA question, you have something called partial scoring. And in the NGen style question, you have partial credit is now given in 3 different ways: the positive, negative scoring, the dyad, and the triad scoring. So what exactly are these? So the positive negative scoring allows the test takers to earn 1 point for each correct response, but lose 1 point for each incorrect response. So if the total score is negative, then it will be 0. So in your SATA question, if there are 3 possible answers and you chose 4, one of it would be wrong. So therefore, instead of getting 3 marks, you would get 2 marks. Right? It will minus 1 from the one that you got correct. So unless you are sure it is an answer in your SATA, do not choose it. The dyad scoring system, if the test takers get 1 point, if both answers in a paired set is correct. So if it's possible 2 answers, you get 1 point for 2. So in a sentence with the drop down, and you have to pick 2 options. If you get both correct, you get 1 point. If it's a 3 scoring system and where there are 3 possible answers, then you get 1 point for each correct answer. If all 3 are correct, then you get 2 points. Okay? That's the triad scoring. So if you have 3 possible answers, you get 2 points. Any question on that?
No.
No,
All right,
miss.
so that's the end of for today. I don't want to go into the engine just yet. We will do that when we are doing strategies on answering questions, which would be your 3rd class. All right.
Okay.
All
One
right, so
question.
that's it. Yes, sure, go ahead.
I don't know if I missed it, but which country did you do your NCLEX in?
The US, but if you don't have a US visa, you can go to Puerto Rico, England. I know somebody went to Brazil.
And
We
Mexico.
just have to, and Mexico, yes, Mexico as well.
Okay.
All right, so it doesn't matter which board you sign up for your NCLEX. We are just using a board that does not require a social security number. All right, wherever you sign up for it, when it's time to choose your exam, you choose which state you want to go. It's completely independent of the board of nursing that you are going to be registering with. So if you have family, if we go with Colorado or Illinois, and you have family in Florida, you can go in Florida and stay by them, and we would look for a Pearson VUE site close to where you are. If you don't have family and you're going independently, we would look for Airbnb or a hotel close. If it's within the US, you just take an Uber and go. So you're going like a day or 2 before your exam, depending on your finances, because remember, you have jet lag. And if you are a morning person, you could choose a morning exam. If you are an evening person, you choose an evening exam. You just have to know what you are. So the morning exams usually start, I think, at 9, and the evening exams at 1.
All right.
All right. Any more questions? All right. So I want you all to be committed to it. Know that you're going to be eating, breathing, living. Now, the 7th month, we didn't discuss the 7th month. So your first 6 months is, let me put it back on recording. Sorry.